The aim of this video is to support teachers and other people working with children who have epilepsy. A fundamental part of being able to understand and support a child with epilepsy is to have a basic knowledge of the condition and what it involves. In conjunction with this DVD, a document is also available. This pack contains practical information, standardised healthcare plans and template forms that can be adapted for each school. It can be downloaded from www.into.ie and www.epilepsy.ie.
When I was first informed that I had a child with epilepsy, I was anxious and nervous about how to deal with things, but as the time progressed and I spoke with Sarah and Sarah's parents so much about the issue, I feel very confident on how to deal with it. I was almost an expert in her plan throughout the year, and I knew exactly what needed to be done if something did arise or if something was even starting.
So what is epilepsy? Epilepsy can be simply defined as a tendency to have recurring seizures which originate in the brain. A seizure is a brief and temporary malfunction of normal brain activity. The malfunction is caused by excess electrochemical activity in the brain. Seizures can cause an intermittent disturbance of consciousness, behaviour, emotion, motor function, perception or sensation. The level of disturbance is dependent on the type of seizure. Seizures can be classified into two main types, partial and generalised. Partial seizures are when the malfunction is located in a small section of the brain, the location of which determines how the child is affected. For example, if the malfunction occurs in the part of the brain that involves sensory perception, the child might experience a strange smell, taste, or a visual disturbance. If the child is fully aware of the sensation, we call these simple partial seizures. Partial seizures which involve a disturbance or even an alteration of a child's level of consciousness are called complex partial seizures. With these seizures, the child will not know what is happening to them while they are in the seizure state and will have no knowledge of what occurred during the seizure. These again can vary according to where in the brain the malfunction occurs. The second seizure type is called generalised seizures because the entire brain is affected. These all involve a loss of consciousness during the seizure. There are 5 principal types. Absent seizures. The child will stare blankly, typically for 3 to 5 seconds. The loss of consciousness can affect a child's ability to absorb and understand information. Tonic seizures involve a sudden stiffening of muscles for a few seconds, and if standing, the child will fall. Myoclonic seizures. The person will experience a series of involuntary muscle jerks. Atonic seizures involve a sudden loss of muscle tone. The person will fall suddenly to the ground. Finally, tonic-clonic seizures. These occur in 2 phases. Firstly, the tonic phase, which involves a stiffening of the muscles. The person's breathing will stop, and the person, if standing, will fall to the ground. In the second, or clonic phase, the person's muscles will convulse or jerk. The breathing will return, but will be laboured and noisy. This type of seizure can last minutes.
Absolutely vital that parents communicate with the teachers. Firstly, the type of seizure are seizures that the child is likely to experience, their approximate duration, but most importantly, what to do in the event of a seizure occurring in school for the child's safety, and how to deal with it.
Recording details about any minor insignificant detail about Sarah's appearance in the class or even behaviour in the class is so important to feed back to the parents, because the parents are going to be dealing with Sarah's specialist doctor. They're going to be talking about Sarah and how she's getting on, how she's feeling at all times, and she spends so much of her time in school. It's vital that they know exactly how she is.
My first one is when I was in second, and we were in the caravan, and I was really hungry and I was still a bit tired, and we were making the beds and I just fell and I didn't remember any of that.
One thing we felt was helplessness, because as I say, when the child is in the seizure, there's to be no intervention. You let the seizure take its course.
The most important thing to know is that you cannot stop a seizure unless emergency medication has been prescribed. This should only be administered in full accordance with the prescribing doctor's directions and only by a person who has received proper training in the administration of such medication. In all other circumstances, you must let it run its course, which in most cases will only be from a few seconds to a few minutes.
The administering of the medication would really only happen, if all else fails, if we don't follow the correct steps, putting into position, setting the clock, knowing that the time has to pass, trying to put her at ease and so on, because generally she will come out of it if she goes into a state of seizure.
There are some specific guidelines which relate to tonic-clonic convulsive seizures. These are things you should do. Note the time the seizure started. This will help determine whether there is a need to call an ambulance. Protect the child from injury and remove any harmful objects that may be nearby. Cushion the child's head. Gently place the child into the recovery position when the seizure has finished. Stay with them until recovery is complete. Calmly reassure the child. Every bit as important as what you should do is what you should not do. Do not panic. Do not restrain the child's movements. Do not put anything in the child's mouth. They cannot swallow their tongue. Do not try to move the child unless they are in danger. Do not give the child anything to eat or drink until they are fully recovered. In most cases, there is no need to call an ambulance except if you know it's the child's first seizure, if directed by the parents, if the seizure continues for longer than normal duration of more than 5 minutes. This is why it is important to note the time the seizure starts. If one seizure follows another without the child regaining awareness between the seizures, if the child is injured during the seizure, if you believe the child needs urgent medical attention, or if you are in any doubt about the child's well-being.
The biggest factor for us when dealing with a child with epilepsy is for us not to panic, for us to be calm, and for us to protect the child.
There's a massive feeling of helplessness. You just got to calm yourself, still yourself, and just wait the seizure out. It's important that you stay calm from the child's point of view, because the child is aware of what's going on around them in a lot of cases. So stay calm, talk to the child and reassure the child.
It is also important to note that epilepsy is not a static condition. Seizure type and frequency can change for many reasons. Ongoing treatment is often based on the number of seizures a student has between hospital visits. If seizure activity goes unnoticed and/or unrecorded, the student will not be receiving effective treatment. If there are any changes in the type and/or dosage of medication, which may happen as the medical team try to find the most effective treatment for the student, extra seizures may also be experienced.
We do have a specific plan for Sarah. Every member of staff was aware of it. We were issued with a copy by Sarah's parents, and it was great that we had that communication with Sarah's parents. For Sarah, I know there were specific things that I needed to know, and when Sarah's parents gave me a list of things to really concentrate and look out for, I was able to focus my attention more specifically on her in the class and in the bigger group environments as well. So getting the information so clearly and specifically was vital to me.
Unless the student's medical team have advised otherwise, all students with epilepsy should be encouraged and allowed to participate in all school activities. Once all health and safety measures are in place, a common sense approach should be taken.
She does a full range of normal activities, so by and large Sarah is the same as anybody else in her class, in her own mind and in their mind.
School staff or group leaders should be aware if they have a student with epilepsy in their group. If a trip is planned, the school should inform parents and students so necessary preparations can be made. In conjunction with this DVD, please review Managing Chronic Health Conditions at School, a resource pack for teachers and parents. It can be downloaded from www.into.ie and www.epilepsy.ie.